A joint in general are two surfaces working with and against each other to provide function and movement. We progress to a point of requiring a joint replacement when that function goes down, when the surfaces are no longer symmetric, when we start having other changes, losing our cartilage, having excessive bone growth, and even getting deformity. Joint replacement has changed immensely in the last 5 years. First of all, the concept of which many of us, even myself, when growing up and treating people for a large time in my practice, you would prepare your patients, and people with joint replacements, they'd be in the hospital for a number of days. They would leave the hospital and go to another setting that's not their home for a number of days or even a couple of weeks for rehabilitation, and then they would go home and there'd be a very slow process of recovery. At this point in time, with many of the surgical techniques that we have, with a lot of the instrumentation that's been developed and a lot of the offerings and our much, much better pain management control, people come into the hospital and for the most part, over 90% of the time with a primary joint replacement, leave later that day or the next day. And where are they going? They're going home. And for people that do what many of us do in modern day world, using computers, using telephones, having meetings, many of these people are back that week at work. Really, the goal of joint replacement is not to take you out of life for a period of time, an extended period of time. The goal is to get you back into life quickly, and not only that, to get your life in an improved state than it was before you received the joint replacement, to allow you to do all those things you wanted to do that you couldn't with your diseased joint, as well as to allow you to do things you never imagined you could do, and also, hopefully, to not even remember which side of your body your knee hurt on.